Welcome to the Dizziness Summit. We're here today with Dr. Cassandra, who's a lead clinician at the Neurologic Wellness Institute in Wood Dale, Illinois. Dr. Cassandra specializes in treating people around the world with neurological conditions such as dizziness and specializes in vestibular rehabilitation, and we're honored to have her today. So thank you for being here, Dr. Cassandra.
Yeah, thank you for making it possible and inviting me to talk on the summit. I'm very happy to be here.
First question I have is, how common is dizziness and how prevalent is dizziness in hospitals or a doctor's office? How many people get dizziness throughout their life?
So we see a lot of cases with dizziness in our clinic, but in general, there's a lot of people affected by dizziness. There's research that it says that it could be 15 to 35% of the general population affected by dizziness. There's other research that says that almost every patient or almost every person is going to be affected by dizziness at least one time in their life. Wow. So it's very prevalent. It's very important for the practitioner to know what type of dizziness the patient has, because in that way it's going to help us to narrow the differential diagnosis. It's going to help us order more specific diagnostic, and it's going to be important for us to know, because in that way, if we need to refer out, then we will do it.
Perfect. So let me ask you a question, because I'm sure a lot of people get dizziness and they might not really have a background or understanding, and it can be a very scary thing. So out of nowhere, if I start getting dizzy and start worrying, and I come to see you and I tell you I'm dizzy, how can you help me figure out what type of dizziness do I have?
Yes, so there are different types of dizziness. It could, patients can describe it like rotational dizziness, disorientation, lightheadedness, rocking. It can be unsteadiness, or the ones like rotating dizziness is also referring like vertigo. For vertigo specifically, it's less like a false sense of motion of the word rotating in relationship to us, or us rotating in relationship to the environment. So, and this one, the last one, is very common. There has been reported up to 20 to 30% in adults. So it's very important to know what type of dizziness are you having, so I can make the proper diagnosis and the appropriate rehabilitation for it.
So right now what you're saying, there's a difference between someone feeling like they're spinning in a circle, and that's one form of dizziness, and then other people have things like lightheadedness or just unsteadiness or balance issues, and they could all say they have dizziness.
Yep, that's correct.
Okay, and then what do you do in your clinic to help differentiate between the different dizzinesses, and how do you know which ones are more important to refer out and which ones you think you can actually treat without referring to the hospital?
In the office, we do a full neurological examination. This includes visual testing, balance testing, and cognitive testing. We do specific tests that if they're positive, then we are gonna we're gonna refer out immediately. But also the research says that up to 90% of the cases that are having dizziness.
So why don't you tell me some personal experiences about patients that you've been able to help with dizziness?
So in the clinic, I can talk about 3 different cases that has different causes of the dizziness. So the first one was an innate ear problem, so specifically what we call Bppv. For this one, what I did was specific maneuvers, and with these specific maneuvers, we can get up to 100% of improvement on their symptoms in 1 or 3 days. I had another patient that she had problems with her vision. So for this one, with this specific eye head exercises and eye movement exercises to improve their vision, and she was able to see better and the dizziness decreased. One other patient that I had was a patient with anxiety. So there's a lot of research that we can see a correlation between anxiety and dizziness. Actually, you can say 28% of the patients that has dizziness can report anxiety problems. So for this patient specifically, we did a combination of neurofeedback, and we did a combination of eye therapy too, so other type of vestibular therapy. And so we can see that there are three different patients that had three different problems, and we can resolve the dizziness based on my physical examination and my assessment.
So you had 3 patients that all came to you with dizziness, and you were able to assess them, and each patient had a different reason for their dizziness, which actually meant you needed to do different therapies for each patient to help them with their dizziness, despite the fact initially they all came to you with the same complaint of dizziness. Is that correct?
Yes, that's correct.
Wow. So is there anything else you want to leave us with before we finish up?
In conclusion, we know that most of the people are going to experience dizziness at some point of their life. We also know that the older the people get, the more the probability is to get dizziness, and it can be very debilitating for them, and it can affect negatively the quality of life. Even though most of the cases are not life-threatening illness because they are very rare, it can affect people socializing, going to stores. They can avoid leaving the house, or it can interrupt just like every daily activity. It can interrupt just like going out of bed. So I just want you and the patients to know, or the people that are watching, that there's hope, and there are people that specialize in treating dizziness, and we are here to help.
Dr. Cassandra, that's great. I know from my personal experience, everybody who has dizziness a lot of times is really afraid of, are they having a stroke? Do they have a tumor? But like you said, the percentage of people who have those things are really, really small. Most of what we see are people who are dizzy and they don't have a stroke or tumor. They have a functional dizziness, or a problem with their inner ear, or a problem with their neck, or a problem with their vision, or anxiety, or things you talked about. And the fact is, it's not going to kill them by any means, but it completely destroys their quality of life, where a lot of people feel like they might as well be dead because they can't go hang out with their friends, they can't go hang out with their family, they can't get out of bed, they feel like the world is spinning all the time, and it really, really affects how people enjoy their life. And it's really, really important, like you said, that people find somebody trained in dizziness and vestibular rehab and know when you need to refer out right away, and know when you don't need to refer, but when you really can help somebody overcome their dizziness to get back to their life as soon as possible. So I really appreciate you coming today, and I'll speak to you soon. Thank you.
Thank you.